Do you know that kidney cancer is often called a silent killer because it can develop without obvious symptoms in its early stages? But here's what most people are not paying attention to: feeble warning signs your body sends that could indicate something is wrong. Every year, over 79,000 new cases of kidney cancer are diagnosed in the US alone, often leading to delayed treatment and poorer outcomes.
In the United States, we expect that about 2% of men and 1% of women will get kidney cancer during their lifetime. In fact, in 2022, we expect about 79,000 cases of kidney cancer and 13,000 deaths due to kidney cancer.
According to the American Cancer Society, early detection increases the 5-year survival rate to 93%. But most people miss the early signs because they are so easy to overlook. What's even more important is that kidney cancer often presents with symptoms that mimic less serious health issues, causing many to dismiss them entirely. In the next few minutes, I'm going to share with you 7 subtle signs that could help you catch kidney cancer early and save your life. These are not the typical symptoms like kidney failure you have likely heard about. They are the unexpected signals your body sends before the disease progresses. Most people ignore these signs, thinking they are nothing to worry about, but recognizing them early can make all the difference. And let me be clear, this is not just another scare tactic about minor health complaints. We'll be focusing on scientifically backed, evidence-based insights that have already helped thousands of people catch kidney cancer early and improve their outcomes. Stay tuned because this is about empowering yourself with the knowledge to take the right action at the right time. By the end of this video, you'll have the tools to spot these warning signs and take control of your health. But before we continue, this content is provided for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions about your health or a medical condition. Now, let's dive in. 1. Blood in the urine. One of the most overlooked early signs of kidney cancer is blood in the urine, medically known as hematuria. Unlike more apparent symptoms, this one can be subtle, often appearing occasionally and in varying amounts. For some, the urine may take on a reddish or pinkish hue, while for others, the blood may not be visible to the naked eye and can only be detected through a lab test.
The most common sign behind kidney cancer is having a painless hematuria, which is blood in the urine that appears sometimes out of nowhere and it's not associated with any pain.
Hematuria occurs when a kidney tumor disrupts nearby blood vessels, causing them to leak blood into the urinary tract. However, because it's painless and can come and go, many people dismiss it as a side effect of dehydration, urinary tract infections, or even exercise. While these conditions are far more common, assuming it's nothing serious without proper evaluation can delay critical treatment. According to research, hematuria is one of the earliest detectable signs of kidney cancer, and addressing it promptly can significantly improve treatment outcomes. Remember, early detection of kidney cancer increases the chance of successful treatment and long-term survival. 2. Persistent lower back pain. Another alarming yet frequently ignored sign of kidney cancer is persistent pain in the lower back or side, also known as the flank area. Unlike temporary discomfort caused by muscle strain or poor posture, this pain often feels deep, dull, or aching, and doesn't go away with rest or over-the-counter pain relievers.
If you have ongoing pain in your lower back below your ribs, this could also be a potential sign of kidney cancer. If you notice you have constant dull or sharp or stabbing pain in that area, it's important to get checked out. It could also be related to kidney stones, however, but it's still worth seeing someone.
What makes this symptom so concerning is that it's easy to mistake for more common conditions like kidney stones, urinary tract infections, or even general fatigue. However, in the case of kidney cancer, the pain occurs due to the tumor's growth pressing against surrounding tissues or organs, disrupting their normal function. The pain may start as mild discomfort and gradually intensify over time, signaling a potential red flag. This discomfort often occurs on just one side of the body, depending on which kidney is affected, but it can also present bilaterally in rarer cases. Ignoring persistent pain could lead to delayed diagnosis, allowing the cancer to spread beyond the kidney to nearby lymph nodes or organs. According to research, treating kidney cancer in its localized stage offers a survival rate of over 90%, compared to just 13% when it's detected after metastasis. If you experience flank pain that doesn't improve after a few days or worsens progressively, consult your healthcare provider immediately. Early action can save your life. Before we move on, if you are looking to dive deeper into the early indicators of cancer, be sure to subscribe to the QuickTime newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you reduce weight and feel your best delivered right to your inbox. 3. Unexplained fatigue and weakness. Another significant early warning sign of kidney cancer is persistent fatigue and weakness that cannot be explained by your daily routine, stress, or lack of sleep. Unlike temporary tiredness, this type of fatigue lingers even after rest and gradually worsens over time, often interfering with your ability to perform normal activities. Fatigue occurs in kidney cancer due to several underlying mechanisms. First, the growing tumor can cause chronic blood loss, leading to anemia. This oxygen deficiency results in constant feelings of exhaustion, dizziness, and even shortness of breath. Additionally, kidney cancer can trigger the release of inflammatory substances, known as cytokines, which alter your body's metabolism and energy production. What makes this symptom particularly concerning is its nonspecific nature. Many people attribute fatigue to aging, busy schedules, or other common health issues like thyroid disorders or depression. As a result, this critical red flag often goes unnoticed until the cancer has progressed. According to studies, nearly 70% of kidney cancer patients report fatigue as one of their first noticeable symptoms. Early intervention could be the key to preserving your health. 4. Unexplained weight loss. A sudden and unexplained drop in weight can be one of the earliest signs of kidney cancer. Unlike intentional weight loss through diet or exercise, this type of weight loss happens without effort and may occur over weeks or months, often raising concerns when other symptoms begin to appear. In kidney cancer, weight loss is primarily driven by metabolic changes caused by the disease. Tumors release inflammatory proteins, known as cytokines, which disrupt the body's normal metabolic processes, leading to a phenomenon called cachexia. This results in the loss of fat and muscle mass, regardless of calorie intake or physical activity. Additionally, as the kidneys struggle to function properly, toxins may accumulate in the bloodstream, affecting appetite and digestion. Patients often report reduced hunger, nausea, or a sense of early fullness when eating, further contributing to their weight loss. Many people chalk it up to stress, changes in lifestyle, or aging, delaying critical medical attention. However, sudden weight loss of 5% or more of your body weight within 12 months, without changes to diet or exercise, should always be investigated. Addressing unexplained weight loss promptly can lead to the detection of kidney cancer when it is still treatable, significantly improving survival outcomes. 5. Swelling in the legs, ankles, or feet. Swelling in the lower extremities, particularly the legs, ankles, or feet, can be an overlooked but important early sign of kidney cancer. This condition, known as edema, occurs when excess fluid builds up in the body, often as a result of impaired kidney function caused by a tumor. The kidneys play a critical role in maintaining fluid balance in the body by filtering waste and excess water from the blood. When a kidney tumor disrupts its normal function, fluid can accumulate in the tissues, leading to noticeable swelling. Kidney cancer-related edema may also result from reduced protein levels in the blood, caused by the kidney's inability to properly filter proteins. According to research, edema is reported in about 20 to 30% of kidney cancer patients, and its presence can indicate that the disease is affecting kidney function even in its earlier stages. If you notice persistent swelling in your legs, ankles, or feet that doesn't improve with rest or elevation, consult a healthcare provider immediately. 6. Frequent fevers or night sweats. One of the often ignored early warning signs of kidney cancer is frequent fevers or night sweats that seem to occur without a clear reason. Unlike fevers caused by infections, these are often persistent or recurring, and they may come and go unpredictably. Kidney cancer can trigger fevers due to the release of cytokines, which disrupt the body's temperature regulation, leading to intermittent fevers or excessive sweating, particularly during the night. Night sweats may leave you waking up drenched, even in a cool environment, and unable to identify an obvious cause like infection or external temperature changes. In some cases, these fevers are low-grade and persistent, while in others, they can spike higher and be more sporadic. Night sweats often follow a similar unpredictable pattern, leaving people feeling fatigued or weak due to disrupted sleep cycles. If you experience recurring fevers or drenching night sweats without a clear cause, it's essential to consult your healthcare provider. Persistent or unexplained fevers and night sweats could be your body's way of signaling a deeper issue that requires attention, and early detection can save your life. 7. High blood pressure. Unexplained high blood pressure, or hypertension, can be an early and surprising clue of kidney cancer. The kidneys play a critical role in regulating blood pressure by balancing fluids and producing hormones like renin, which control blood vessel constriction. Unlike primary hypertension, which is often linked to lifestyle factors such as diet, stress, or weight, kidney cancer-related hypertension may develop suddenly and be resistant to typical treatments. This occurs because the tumor can cause the kidney to overproduce renin, resulting in narrowed blood vessels and increased blood pressure. Patients may experience symptoms associated with hypertension, including persistent headaches, dizziness, blurred vision, or even nosebleeds. What makes this symptom particularly concerning is that it's often overlooked or attributed to other common causes, delaying critical investigation into its root cause. Don't dismiss high blood pressure as just a common condition. In some cases, it could be a sign of kidney cancer, and catching it early can significantly improve treatment outcomes and survival rates. Listen to your body, your health depends on it.